I think that the MedEntry workshop was challenging, collaborative, and very thorough. Overall, that's how I describe it. I think the best thing about MedEntry was the online training platform that they provided. So coming out of the workshop, I actually felt a bit overwhelmed. I knew that I had this really big task ahead of me. But once I was able to consolidate my learning over the whole year pretty much, I had a good amount of time, and I was able to approach smaller tasks like the drills, build it up through practice exams, and I was working with questions that had been written properly, that had been written to the level of the actual UCAT. And I was able to really test myself rigorously and to reflect upon where I was at. They provided feedback as to where I was sitting amongst other MedEntry students. And in doing so, I was able to really track my progress and see improvement. And that was my favourite thing about the MedEntry course. So the best thing about the online platform for me was the fact that we were provided both drills, which you could do, for 10 minutes each night if you wanted, as well as the proper structured practice exams. So this allowed me to space out my practice exams because they're a really valuable resource, but also just incorporate, so I did almost daily practice just to keep it ticking over because it's a big challenge. And so the best thing I found was being able to intersperse the exams with the drills that were provided. And I also really liked the videos, particularly for the abstract reasoning skills. So the questions from MedEntry, in comparison to the actual UCAT, I found that the questions were really very similar, especially in comparison. I had done the exams provided to us by ASA, and I found that they were far easier. So I think I was really lucky to be able to access the MedEntry resources because they were pretty much bang on. They were really accurate. Before going through MedEntry regarding my feelings towards the UCAT, I was quite apprehensive. I think I was pretty much on top of my schoolwork, and the UCAT sort of loomed for me as the biggest obstacle to getting into medicine. I'd met a lot of people who I thought were really well suited for the course and who had actually missed out on it because of getting quite blindsided by this really unique test. So I felt definitely that it was something that I wanted to prepare for because I knew it was a big challenge, and it was just a matter of finding a way to prepare for it. Initially, I felt a bit overwhelmed. I'd been hit with 2 days of lots of content, and I was being taught by this super smart doctor who could do all these problems, and it seemed almost a bit insurmountable at first. But as I progressed through the online course and did my training, I certainly felt a sense of improvement. And I think the main thing coming out of the course, even though it was a bit overwhelming, I also felt that I was in good hands. I had a sense of purpose. I knew the steps that I needed to take. And so even though perhaps I wasn't starting it, I was starting probably at a level of competency below what I would have liked, I knew there was a way up. So I felt much better about the whole thing. When I received my result, I was pretty shocked. I didn't think I'd do that well, and I was very relieved because this had really, for me, been the biggest obstacle probably towards getting into medicine, and so that was a massive weight off my back. I felt that I could really just focus now on my schoolwork and be a whole lot more relaxed about the whole process. Studying medicine is really fun and challenging. I love how diverse all the tasks we do are. So we go from quite scientific teaching to hands-on work in anatomy and clinical skills, and then also grappling with some bigger ideas in subjects like ethics and public health. I'm loving the cohort. I'm finding it's a really diverse group of people with different skills and talents. And yeah, it's been really fun, and I feel that I'm on a good path and on my way. For people wanting to get into medicine and needing to take the UCAT, I would first advise that the UCAT and the interview really are sort of unique hurdles that you have to pass to get into medicine, and so you need to prepare for those specific events because I've seen lots of people who were really great, well-rounded students, but because they hadn't prepared for that specific challenge, they were quite blindsided by it and didn't do as well as they probably should have. So I think undergoing some specific training is really good, but also just on a broader sense, it's really important to stay well-rounded and look after yourself. I think that sleep was my biggest weapon. I always got at least 8 hours of sleep, and that I think was really important for me. And sort of on that theme, I think with your study, it's really about quality over quantity, and that was something that I really learned through MedEntry, this process of attempting, reflecting, reviewing, reattempting. It's not about how many questions you get through, it's about how much you learn from each question that you do. So that's a really important process for UCAT preparation and for your schoolwork as well.